Hello, this is Eric Devereaux, and I'm giving you another video today based on my textbook, Methods of Policy Analysis. The textbook is available to you for free, and there's a link in the description below for you to access the textbook if you don't yet have it. So today we're going to move forward in a discussion about how we choose among different alternatives for making a public policy. Previously, I've talked about how you can use process models to identify alternatives. And then in the most recent video, talked about how you could use a matrix method where you list your alternatives, you list your criteria for evaluating the alternatives, you have values on the criteria, and then you have some type of decision rule that you use to select among the alternatives based on how you wish to treat the criteria. Now, one of those criteria is efficiency. And efficiency is a very broad topic in public policy analysis. And frankly, there are a lot of people who teach public policy analysis and write about public policy analysis from the perspective that efficiency essentially is everything. And there are some leading textbooks in the field that are built completely around conceptions of efficiency rooted in microeconomics and connected to the topic of benefit cost analysis, and using that entire approach to say this is really what public policy analysis should do. Analysts should focus on matters related to efficiency when evaluating alternatives and presenting alternatives to their clients, to their organizations. I'm going to go a little bit beyond that today, and then in future videos, even further beyond it into other criteria that I previously discussed. But today, we're specifically going to be focusing on efficiency. So the actual direct topic for today is social return on investment. Let me do as I've done before and start off by just showing you the first page of the chapter in the textbook about social return on investment. You should be seeing that now. So this chapter goes into a pretty deep dive about social return on investment, defining it and showing you examples of how to use it. The most important broad point I want you to take away from here is that social return on investment is a very feasible approach to thinking about efficiency that looks at direct and potentially indirect costs to the taxpayer. And so the taxpayer becomes the surrogate for a measure of the public interest, the public good, or the client's overall interest in a particular policy problem. You talk about how can we save the taxpayer actual money through some type of intervention in society, which can move us from a less optimal, a less acceptable to a more acceptable outcome. And one definition of more acceptable is that we have reduced the burden on the taxpayer of a problem. And we can even try to evaluate, assess, and measure how much we have reduced that burden. There have been many examples in the last couple of decades where social return on investment analysis has had a major impact on public policy. One that I talk about in the book is an analysis that showed very, very negative consequences for the taxpayer for suspending or expelling students from high school. Often these students turned out to be from diverse and disadvantaged communities. Once suspended or expelled, they had a very low likelihood of completing high school, which meant they had a much higher likelihood of needing to receive public benefits through social welfare programs, and also, and very unfortunately, to have a much higher likelihood of ending up with criminal justice system involvement and incarceration. Public welfare programs and incarceration are very expensive, and those costs are directly borne by the taxpayer. If you can engage in some type of an intervention that can prevent that from happening, then you can demonstrate powerful social returns on investment. Now let me do as I've done before, and let me switch and use a device that allows me to make some notes for you in real time. You should be seeing that device now. And so I'm going to go through a couple crucial aspects of social return on investment that are also in the book. So the topic again is social return on investment, or SROI. And to begin with, I want, as I do in the book, to talk about four different categories of interventions. So we have palliative interventions. We have a problem, and We engage in a palliative approach, and here we treat symptoms. Okay, that's what we do with our palliative approach, is that we treat symptoms. Okay, next and more consequential is we have curative approaches. Something has happened, something has gone wrong, and then we try to restore or heal, get back to where we were before. Something went wrong. Now we'll try to get ourselves back exactly where we were. We will try to actually cure something. And then, of course, there are preventative approaches. So, preventative approaches, we try to avoid problems altogether. Just don't get into this situation where we have to use resources through a public policy to try to fix something. And then the most consequential, and one that is frankly rarely really practical, as unfortunate as that may be, are systemic approaches. Systemic approaches, we try to eliminate causes. Right? We try to actually make sure this can't ever happen again because we have removed the causes. So let's talk about, just really quickly, an example that I've already gone through in the textbook, which is nicotine addiction, smoking, tobacco use, and all of the negative consequences that come to that in terms of public health. So palliative is somebody becomes ill from their nicotine habit, and we just try to treat the symptoms as best we can. Curative, someone gets lung cancer or some other really negative health condition, and we try to cure them of that, up including some very, very expensive and invasive procedures, such as entire lung transplants. I had a neighbor where I used to live in Maryland who was a heavy smoker and eventually received a double lung and heart transplant as a consequence of that. Lived for about 3 more years after that very invasive procedure, following a lifetime of heavy smoking. And then preventative, we try to avoid nicotine addiction, for example, through messaging to children saying that nicotine addiction is really bad for you and you shouldn't do this. Or we might impose a bunch of taxes to raise the price of buying nicotine products or put restrictions on the flavors of vapes and other things. Do everything we can to try to prevent this from ever happening in the first place, so then we don't have to treat the health consequences later on. Systemic change would mean that, among other things, nicotine simply isn't available in the marketplace. It just can't be purchased. These products are no longer available, and that means that no one can ever, under any circumstances, become addicted to nicotine and suffer the health consequences therein. Okay, so SROI tends to increase as you get toward systemic change. This has the highest SROI, and this has the lowest SROI. Because as we move in this direction, we increasingly can save the taxpayer more and more and more money, in terms of trying to intervene to fix a problem that maybe should never have happened in the first place. But at the same time, preventative and systemic change is almost the most difficult to achieve, and for a variety of other reasons. And sometimes we just have to go back to curative or palliative. One of the problems that I will identify immediately up front is there are often no champions for preventative approaches, because prevention, one person's prevention, means another person loses their profit. And the place where this really becomes problematic is in the healthcare system. So the more we become adept as a society at preventing a variety of illnesses through encouraging healthier behaviors, more exercise, better diet, less consumption of alcohol or cannabis, no consumption of nicotine, these measures result in less opportunities for the healthcare system to treat expensive, difficult conditions, which means that the healthcare system's profits go down in a for-profit healthcare system. So one of the trickiest things that's happened is that sometimes you don't find the healthcare system in the United States actually championing prevention the way that often that system says it should, because that just means that hospitals, doctors, pharmaceutical companies, and medical laboratories will make less money. And that's just a fundamental fact of life. Okay, something else that's in the book that's incredibly important is I ask you to think about, when you're talking about SROI, to think about four different categories of individuals who might be affected by an intervention. So, well, let me get a different pen here for a minute. Um, so let's start out with a cohort, right? We have a cohort of people who are going to be brought into some form of social intervention, and uh, this is 100% of the cohort that's brought in at a given time. Okay, and then I ask you to think about who is within this cohort. So first off, there is a group within the cohort who simply do not require the intervention. Okay, they succeed, right? They succeed. Um, these are the unnecessaries. They succeed and they would succeed with or without the intervention. And if you let them into the program and you spend money on them, you cannot claim that there's a return on investment because they didn't need the program in the first place and they would have succeeded anyway. And there's many social intervention programs have this exact problem. They've let people in who simply didn't need the program. Then there's a group that start out, okay? There's a group that start out where they really, really, really need the program, okay? These are the necessaries. This program is necessary, okay? Um, but they break into two groups at the end here, unfortunately, okay? Um, one group completes the program exactly as you wish, okay? And without it, they would not complete the program. But unfortunately, there's another group within here that for whatever reason you could never have predicted fail, okay? And do not succeed. The program does not work for them. It was not, at the end of the day, truly necessary and sufficient. But what often derails this group is derailed by unforeseen circumstances. Okay? So these are the unsuccessfuls. I'm going to give an example of a couple of these as we talk along here, okay? And then lastly, you have one last group that is a real problem. I'm going to also use red for them because they don't succeed. This is the group that you should never have let in the first place because the intervention was entirely insufficient, okay? For the insufficient group, the intervention was never going to work. Let's talk about uh, treating people who have unfortunately fallen into opioid addiction, which is a terrible problem afflicting our society at this time in the United States. So, first off, there's a group who, for whatever reason, they're going to get off their opioid addiction. They are going to clean up their lives and move on. And sometimes we don't, and this group often may be correlated, for example, with having access to extraordinary resources that other people do not have. Maybe they've got a family with some wealth and other means to otherwise help them overcome this, and they don't need your program. Okay. Then there's those that do need it, and you put them into let's say, a drug treatment program, a residential drug treatment program to try to get them off their opioid addiction, and they succeed. But within that is a group that they don't succeed. For whatever reason, it doesn't work. It should have worked going in, but something went horribly wrong. Let's say some other terrible life stressor emerged, or some other crisis happened that you could not have foreseen, and they fall back into their addiction as a consequence of that. And there's a group where this program simply is not sufficient to help them. They, for whatever reason, have life circumstances where the design of the program is just not good enough. And in some cases, I talk about in the book, and it is heartbreaking, you encounter situations where you may come to believe that no program of any conceivable design could actually help this person to have gotten out of this addiction. Maybe they just, unfortunately, have, for example, biological factors that make them so prone to addiction and have such a difficult time overcoming addiction that you just can't fix it. And it does happen, as much as we don't want to admit that. Now, the point that I make in the book about this is that this is where your SROI comes from. Your SROI, your social return on investment, can only be calculated based on the necessaries who actually get through and succeed. All the money that is spent on these other groups cannot be counted as a benefit because it didn't work. You didn't need the expenditure on this group in the unnecessary, so that's just wasted money. And it's wasted money here because it was never going to work in the first place. And unfortunately, it's wasted money here because it just didn't work for other reasons you couldn't have predicted. So the thing is, the way that SROI works is that it is basically based on the achieved benefit minus the total cost over the total cost. I also use average cost in the book, which is perfectly fine. Okay. And so your achieved benefit is only calculating based on this group that needed the intervention and succeeded. Everybody else has to be taken out of the mix in terms of a benefit because there was no actual benefit. Okay. And there's examples in the book that go into this in tremendous detail for how to actually do these calculations, but they're just based on using percentages over the known costs. The last thing I'm going to talk about today here, and you can look at examples in the book, which goes into great detail, is sensitivity analysis. Okay. And SROI sensitivity analysis is incredibly important to do because these numbers are squishy. Let's be very clear right up front. These numbers are always a little squishy. And one of the things I want you to avoid is falling into the trap of accumulating a lot of benefits from indirect consequences of an intervention. And if you're not careful, you can push up your SROI estimate very, very high. And if you look around at when these estimates are done well, often you'll see nonprofit organizations that do social intervention. They will say our SROI is in the range of 3, which means for every dollar that we spend, society saves $3 in costs that we have helped society to avoid. Okay. And that's a great number. 3 is like a very reasonable number. One of the most famous numbers, James Heckman, University of Chicago, calculating the benefits of high quality early childhood education, came out with 17. And the study that's referenced in the book about the benefits of not suspending or expelling high school students came out with an incredible number, around 300. When school districts all over the United States saw that 300, which is just an unbelievable number, but it seems very solid. Many school districts all over the United States said, that's it. We are no longer going to do suspensions and expulsions other than in-school suspension. Well, we'll keep the student in school in a special room. We'll continue to educate them. We'll deal with whatever behavioral consequences or issues are here, but we will not throw them out of the school. It really transformed that. Another place where SROI has actually had a major transformative effect has been in the field of incarceration and helped to eliminate incarceration as an option for a variety of nonviolent offenses because it's just so expensive to put people in prison. But in terms of SROI sensitivity analysis, what you often find yourself doing is based on the formulas that you've worked out. You can, for example, you can look at your success rate for the program, which is based on those who are necessary and sufficient. Right? The program was necessary and sufficient to produce success. Okay, both necessary and sufficient. And you can look at your SROI estimate. And what you often see is this, is that as your success rate goes up, your SROI goes up. Okay. And then what you can do is you can identify this point right here and say, this is our break-even point. As long as we do better than this percentage in terms of our success rate, we actually are giving net benefits to society, okay, in using social return on investment analysis. There's another example in the book where I look instead at the cost of the program and how much money can you spend before you're no longer producing net benefits. But you use sensitivity analysis to come up with range estimates and to talk about the likely scenarios in which you're actually going to be doing some good. In my own consulting work, I've had to do this at times for a variety of reasons. And you can say to your organization, you can say to your client, as long as we're above this success rate, we're good. Or as long as we keep the cost of the program per person below this level, we are showing net benefits. And that's an incredibly helpful input into the decision-making process. So again, SROI is one way in which we think about uh, 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 efficiency and use efficiency in a decision matrix. There's examples in the book of putting SROI numbers into the alternatives criteria outcomes matrix, using it as the efficiency outcome, and then using it in various calculations to figure out which policy alternative you wish to recommend based on the analysis. Next time, we'll be turning to talking about political analysis and political feasibility, which previously has not been included in in thinking about decision making, but of course is very important. And that will take us to the end of this unit of the book. And then after that, in the next unit you'll see coming up, I will be spending some time on these videos talking about how you effectively convey information about policy analysis to your client. Thank you so much for watching the video. And I hope that this has been a benefit of you from reviewing this material. Bye now.